Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I'm a UK registered nurse of 20 years, a university lecturer of 7 years, and I've been an NMC OSCE programme lead in the past. And on this channel, I'm sharing with you lots of advice and teaching, which will hopefully help you self-study for your OSCE and pass. And today I'm going to be looking at the Alzheimer's APIE scenario. So this can be sometimes a bit of a challenging scenario if you get it for your APIE. So I'm going to go through each of the key components of the APIE with Alzheimer's. So we're going to look at a bit about Alzheimer's. We're going to look at kind of key assessment priorities specifically related to the NMC scenario. We're going to discuss possible care plans that you can look at and prep in advance, and some of the key medications and some things that you might consider in terms of your recommendations. Obviously, just so you're aware, the scenarios that I use in this are ones that I create myself. They are not a guarantee or key replica of the NMC scenarios, but they should help you just prepare for this station if you get it. So for the adult NMC OSCE exam, you have obviously got your 12 potential APIE scenarios, and one of them is the patient with Alzheimer's. So what is Alzheimer's disease? So it's a progressive So what is Alzheimer's disease? It is a progressive neurodegenerative disorder, and it's one of the most common forms of dementia. And it primarily affects kind of memory, thinking and behaviour. And over time, the brain cells kind of decline and you get loss of function and cognitive function. And like with all your OSCE prep, I always say how important it is to read around your subjects and to really understand them, because it will really help you in your exam, you know, develop your care plans appropriately, use the right communication, focus your assessment skills. And nothing should be a surprise for you in that scenario if you have done some background reading. And the NICE guidelines, so NG97, you can put into Google NICE guidelines for Alzheimer's, is a really good resource and tells you kind of all the best practice requirements that we should be offering for patients with Alzheimer's. And the other website, which is quite good, is just the Alzheimer's charity, so the Alzheimer's Society. And that's got lots of really useful information on, which is quite simply laid out as well. So I definitely do a bit of background reading if you're unfamiliar with the condition. So signs and symptoms of Alzheimer's, and this is important to know because this might be how your patient is presenting in your assessment station. So it normally presents to start off with some minor memory problems. So it could be forgetting conversations, maybe events, names, and then it develops as it progresses into kind of more severe symptoms. So confusion and disorientation, difficulty in planning and making decisions, and so this can impact on daily activities of living. It can impact on speech and also with mobility, so problems moving around and completing those self-care tasks. So we already know potentially that in our scenario for the NMC exam, we might have a patient that's got some mobility problems and some difficulties with their kind of self-care tasks at home as well. So we can prepare for those. And then, later it can develop with some personality changes and maybe some aggressive behaviour, and it's also associated with low mood and anxiety. So these are the type of things you might expect from your patient actor or within your scenario. So treatments, there's obviously no kind of cure or treatment, so interventions are very much to manage and reduce symptoms. So medications that are given kind of increased levels of acetylcholine, and that helps your nerves communicate to each other within the brain. Other things that can be offered are things such as cognitive stimulation therapy. So this is being involved in group activities that are to help you with memory and problem-solving skills, and also cognitive rehabilitation. So this is working with occupational therapists to help you achieve a personal goal that you want to do. And you might be going, oh, Hannah, stop talking about all this theory, it's really boring. But these things are really key, because when you're creating your care plans, these are evidence-based and recommended interventions for people with Alzheimer's as recommended by NICE guidelines. So it is really important you know this, and you can add those into your care plan, and it shows the examiner that you have got a good level of knowledge and therefore competence. And also we can use things such as life story work, and using things such as photos, favourite musics, favourite possessions and things like that as well. So back to your NMC OSCE. So just want to remind you that the things I'm going to be talking about today are specifically for the NMC exam scenario, and I'm not in any way stereotyping people with Alzheimer's. I just want to make that really clear. So in your NMC OSCE scenario, this is normally a community-based scenario, so you're visiting a person's home. So just remember that community approach. So there's going to be no ID band, no allergy band. So you're going to do those verbal confirmations of ID, name, date of birth and address, if they remember, or GP surgery. And you're just going to check those and verbalise those against your documentation. So there'll be no ID band. Remember, you're approaching a patient's home and you're not in the hospital. So key common things that come up in the NMC scenario and things you could expect to have is obviously increased memory loss, reduced mobility and maybe a history of falls. There might be some recent weight loss as well. So the patient might be having a reduced appetite, or maybe, not remembering how to prepare meals correctly, or, not remembering, to finish their full meals. So there might be some nutritional issues there. And also you want to make sure and pick up about any social issues at home. So is there things at home that are, causing difficulty, especially with mobility, so lots of stairs, who's caring for the person, or what's the relationship and responsibilities of the relatives as well, and picking up on those and offering support. So those are kind of the key things you could expect. So when you've got the NMC OSCE Alzheimer's scenario, like with all your scenarios, you need to time manage. So I would break the scenario down and do it in the following steps. It's important to keep that systematic approach and to ensure you cover all the marking criteria. So you're going to start with your key principles, your safety, privacy, hands, introduce yourself, ID checks, explain the procedure, gain consent. You are still going to do your full A2 assessment. And then I'd advise you to go on and document your A2 assessment and your vitals on your NEWS2, verbalise your score, your monitoring frequency, and your escalation. So exactly the same as your other APIE scenarios. And then you're going to have in your paperwork your 6 CIT scoring tool, okay? And I'm going to go through this in a bit more detail, but I would then go on to add up that score, verbalise the results and your plan of care, and then use that kind of tool and those questions you're going to be asking around that to lead into your holistic assessment. And I'm going to explain a little bit about that in a little while, and then end your station professionally. Obviously, because you've got the 6 CIT score, it's going to take a little bit more time of your 20 minutes. So you need to be confident and fluid through your A2 assessment and your holistic assessment. So you've got time to add in that 6 CIT. So what would be your assessment nursing priorities? So on the physical side, so like I said, you're going to do your A2 assessment exactly the same. Airway, breathing, circulation, disability and exposure all remains the same. You're going to do your monitoring and recording the vital signs within that. And if you're struggling with your A2 assessment, go and look at my specific video on A2 assessment. It's exactly the same. Now, one of the key areas where nurses can fail is on the APIE scoring with your Alzheimer's patient. So we can very often, nurses put down that the patient is confused, and that is wrong, because in your NEWS2 scoring, confusion is only for new onset of confusion. So if when you are assessing your Alzheimer's patient and you're asking them what the date is, or if they can remember where they are, if they are struggling with that, we need to just check that that is a normal for them. So that's a normal level of confusion for them with their Alzheimer's. So you can just ask, or is that normal for you? Do you often forget the date? And if they do say that, then you can mark them as alert, because we only mark confusion if it is a new onset confusion, or in someone with Alzheimer's or memory loss, if their confusion level has drastically changed. So if it's got a lot worse, or maybe they're a lot more agitated, and that would count as a confusion on your NEWS2. But in terms of your OSCE, your patient's confusion level is normally the same. So we just need to verbalise that, demonstrate to the examiner we understand the difference between new onset confusion and long-term memory loss that we will get with Alzheimer's. So be really careful with that on your documentation, because if you document confusion, it changes your whole NEWS2 score and it obviously fails your station. Remember also you're in the community setting, so you're going to document and verbalise your escalation as per the NEWS2 score, but your escalation is going to be slightly different in the community because you're not going to have an immediate doctor or medical team around. So remember, if their score is 0, you're going to monitor them 12-hourly and you're going to review them on your next nursing visit the following day. If their score is 1 to 4, You're still going to document, you're going to monitor them 4 to 6 hourly, but you're going to speak to the GP and get a review today. That's really important. And if they score 3 in a single parameter, or their score is over 5, they need 1 hourly monitoring, and you must ring an ambulance, and those patients need to go to hospital. So the 6CIT test, so this is the cognitive impairment test, and it consists of 6 questions around things such as orientation, remembering information, counting backwards, stating the months of the year in reverse, and it's scored out of a total of 28. And in your OSCE, in your assessment station, those questions have already been asked and assessed, and you have got numbers in the boxes. You do not need to repeat that, those questions. You don't have time to. And it might say that it was completed yesterday, in which case that's absolutely fine to use. So don't waste time trying to complete it again, because you will run out of time. So I'm just going to show you quickly what that looks like. Okay, so here's a completer tool, which is part of my APIE scenario study book. If you want to purchase those, you can, but this is what it looks like. So you'll have you'll have points, you'll have numbers in the boxes, and you'll just need to add those all up and put your total score in the bottom here. Okay, so it's really important you do that and you document it, otherwise it's a critical fail. And then you'll have your scoring system here, which will tell you kind of the level of cognitive impairment and your follow-up plans, what you need to do. So I'm going to go back to the slides just to explain that. So a score of 0 to 7 is normal and there's no referral needed. A score of 8 to 9 is mild cognitive impairment, and we should most probably be referring to a specialist consultant, Alzheimer's specialist nurse, and things such as memory clinics, for example. And 10 to 28 is a significant cognitive impairment, and again we should be referring to the appropriate specialists as well. So once you've completed your 6CIT, I would recommend that you discuss that with your patient next. So we've done our A3, we've done our News 2, we've added up our 6CIT, and now we're going to discuss it with the patient. And again, it doesn't matter how you phrase it, but think about your communication and being compassionate and with that, and making sure your communication can be understood by the patient. So I might say something such as, you know, I understand you answered some questions that tested your memory yesterday. So I've added up your score, which was 17, and it shows you are having some, you know, significant memory problems. So I'd like to refer you to the specialist doctor and the Alzheimer's specialist nurse, you know, so we can provide further support and assessment. Do you consent to me doing this? Remember, you always need to get the patient's consent. We can also look at providing, you know, things in the home for you, such as some memory aids, memory boards, photo books, and getting the OT in to help you with supporting you with some activities of daily living. And then you can lead that into your holistic assessment, okay? So it's a nice lead in then to discuss the memory loss in a little bit more detail. So you could just find out, you know, a simple question such as, you know, how are you finding that your memory loss is impacting on activities at home? Is there anything that you're finding particularly difficult? Or is there anything that you would like some support into being able to continue to do an activity at home? And it might be something, you know, such as making your lunch or getting dressed, or being able to you know, do an activity about the house as well. So assessment priorities must focus on that memory loss, which is really important. Depending on how much time you've got, you maybe want to pick up a second physical problem if you can. So the risk of falls, so you might want to ask about mobility. Again, depends what information you've got in your scenario. So have you had any falls maybe in the last 3 months? Are you using any mobility aids? Would you like a referral to the physiotherapist? And we can come and have a look at things that can support you to maintain your independence. What we want to always be doing is maintaining independence and safety in the home, and those are kind of our key priorities. Again, it depends on your time and your scenario. You might want to ask some questions around diet and food intake. So are they managing to prepare meals? Is there any recent weight loss or appetite loss? Possible referral to dietitian or some home support with meal preparation, or again, we can provide memory aids. And also, you know, sometimes there's continence problems, but you won't have time to do everything. Remember, you've got very limited on time. So I definitely focus on 2 key main issues. So your memory loss and potentially risk of falls. Psychosocial, so it is important to kind of evaluate the living situation here, what support systems are in place, access to any resources, thinking about support groups and charities such as the Alzheimer's Society, and ensuring that there's a multidisciplinary approach, so involving social workers and community resources as well. And we should be assessing around emotional well-being. As we know with Alzheimer's, there is the risk of low mood and depression. They're going to assess if they are feeling low mood or anxious, or if they're worried about anything, and also, offer support for the relatives that are involved as well, if they consent and the patient consents. Spiritual, again, just very quickly, just ask if there's any spiritual or cultural needs. And sexual, again, to find out more about the support network. So if the wife and the husband is supportive, do they have a good relationship? Would they like any additional support? And you're really kind of showing that holistic assessment kind of skills there. Planning is often a little bit difficult on the Alzheimer's for some nurses, not the same for everyone. So just think really carefully about what you're writing. So your problem could be, that Frankie's got increased memory loss as evidenced by a 6 CIT score of 17. Our aim, we cannot improve that memory loss. Remember, Alzheimer's is a degenerative condition, and sometimes nurses write that and it's a fail. But your aim could be maintain safety in the home or maintain independence with a certain activity of daily living. And remember, your re-evaluation timeframe, you're in the community. This is not going to be a quick fix within 30 minutes or 24 hours. So normally a 7-day re-evaluation timeframe is appropriate. And there's lots of interventions you can do to support with memory loss within the home. So we're always going to plan the care and gain consent. And we're going to always do the vital signs just to make sure there isn't any biological causes of confusion. And it's important to rule those out, such as infection, for example. We're going to continue to assess and record Frankie's 6 CIT. It's really important to develop that therapeutic relationship with the family and understand meaningful activities that Frankie would like to continue to do at home. We would support Frankie to reorientate him with things such as photos and memory books. And we would provide some memory aids in the home as well. So things such as instructions, notes, things to help maintain independence. And we might do that referral to memory clinic or occupational therapist for that cognitive stimulation therapy and cognitive rehabilitation, or discuss that with the doctor for them to make that referral. And provide the family with some support group information and telephone numbers. So those are some key things. So it's quite, if you're not familiar with, writing a care plan for that, those are some pointers there to help you. Other care plans you could prep, so you could prep a risk of falls one very easily, potentially pain in the scenario. There might be some chronic headaches or some other pain from other kind of conditions. So if pain is appropriate, you could use pain, and potentially there could be a risk of malnutrition, again, if appropriate for your scenario and in your information. Implementation. So in terms of your NMC OSCE, the key medications normally are your kind of standard analgesics, so your paracetamol. Sometimes there's antihypertensives, so it's good to have a good knowledge of your key antihypertensive medications, your medications that lower blood pressure, because they can come through quite a few scenarios. Like I said, your medications for Alzheimer's treatment. So your medications for Alzheimer's treatment, again, they might not be due at your time, but they might be on the chart. So it's just good to have an awareness, so you can, they don't freak you out in your exam as well. And specifically in the NMC exam, sometimes patients on levothyroxine and citalopram. So levothyroxine for hypothyroid and citalopram for depression. So those are some key medications to learn, which may help you as well. Evaluation, so it depends who you're handing over to in your scenario. Okay, so I don't have all that information at all, but you might potentially be handing over to an Alzheimer's specialist nurse or the next community nurse, or maybe the GP, for example. So again, identify if there's any concerns. So remember, increased memory loss and your 6 CIT score is a concern. I'm just going to go through the recommendations here because you'll have all your other information from your stations, but you might want that person you're handing over to implement and assess the use of memory aids in the home, reassess mobility and risk of falls in the home, continue to administer prescribed medication, assess physiological observations with each visit, so your news too. Follow up on those kind of multidisciplinary team referrals that you might put in your care plan, social services support, for example, referrals you might have made to physio, memory clinic services, and ensure the family, that and carers know who to contact and have got support. So those are some potential recommendations. Again, it really depends on your scenarios, so make sure you read your scenarios carefully and you are focusing specifically on what you've been asked to do and who you've been asked to hand over. But those would be some of the key things that you may want the next nurse to do and follow up from you. So my top tips for this station is do your background reading on Alzheimer's, go to those nice guidelines or the Alzheimer's Society, and familiarise yourself with the 6 CIT score, appropriate referrals and action plan, and practice care plans, especially for things such as memory loss and risk of falls, and review and learn your key medications. I hope you find that helpful. I offer tutoring, one-to-one OSCE tutoring or small group tutoring if you've got a friend and want to do it together, save a little bit of money. I am getting really busy, which is brilliant, but I am getting very booked up. So I'm now almost booked up into the beginning of November. So just bear that in mind. And, feel free to email me, hannah.outlanes@outlook.com. You can follow my Facebook page, Nurse Tutor Tutoring Planner. Try and put lots of other useful stuff on there as well around the OSCE and updates and things such as that. Also got study books as well if you just want to purchase some resources. So I hope you found this helpful. Subscribe and share my videos if you think anyone will find them helpful as well.